What the World Health Organization wants you to know about visiting the dentist during this pandemic. sHouse podcast episode 3. So on August 3rd, the World Health Organization came out with some interim guidance on dental care. The title, Considerations for the Provision of Essential Oral Health Services in the Context of COVID-19. So a short summary of it up front is that the World Health Organization says you should only go for emergencies, and the American Dental Association, they responded by saying that they respectfully yet strongly disagree. Let's dive a little deeper. So in the introduction of the paper, it says that oral health is important and that maintaining good oral hygiene is strongly recommended. If you do need advice, that it should be administered remotely. So transmission of COVID is mentioned in this paper. It happens by direct or indirect contact with infected secretions such as saliva or respiratory droplets. An updated World Health Organization paper from July does suggest the spread through aerosols, which are less than 5 micrometers in size. That is very small. Aerosol generating procedures are widely performed in dentistry or oral health care settings, as the World Health Organization puts it. These procedures, which would include cleaning teeth with an ultrasonic scaler or using either the high or the low speed drill, they all produce aerosols. And I'm going to quote from the paper, these aerosols can remain suspended in the air, travel over a distance, and may cause infection if they're inhaled. There is one box in this paper, and I'm going to read everything that's in the box verbatim. Here it goes, quote, box number 1, definition of aerosol generating procedures, AGPs, in oral health care. All clinical procedures that use spray generating equipment, such as the 3-way air water spray, dental cleaning with an ultrasonic scaler and polishing, periodontal treatment with an ultrasonic scaler, any kind of dental preparation with high or low speed handpieces, direct and indirect restoration and polishing, definitive cementation of a crown or bridge, mechanical endodontic treatment, surgical tooth extraction, and implant placement, end quote. Yeah, so that's basically everything that happens in a dental office is an aerosol generating procedure. Oral healthcare teams are at high risk of being infected with COVID and passing it to their patients. That's what this paper states. World Health Organization advises that non-essential oral healthcare, including cleanings, checkups, and preventative care, be delayed until transmission rates from COVID go from community spread to cluster cases. However, urgent or emergency care should be provided. So the definition that they provide for emergency care is that it addresses acute oral infections, swelling, systemic infection, significant or prolonged bleeding, severe pain that can't be controlled by analgesia, trauma. All of those things are considered urgent or emergency. So for screening, they want you to call, make sure that the patient doesn't have symptoms, try to do, what you can remotely. And then once they are in, temperature checks. And as far as even these urgent or emergency cases, try the 3 A's first. The 3 A's are advise, analgesics, and antibiotics when appropriate. If a patient has COVID, they do say that, if it's possible to treat them in their house, you should do that. I don't see that happening. I'm not aware of many home care dental teams around here anyway, but maybe it might be more prevalent in other places. So for infection prevention in the office, they want the plastic or glass barrier to be built when you're triaging patients. So the first person that comes in and screens a patient, sometimes it's an assistant, sometimes it's a doctor, whoever it may be, They want there to be a glass or plastic barrier between them and the patient. Oral healthcare staff should wear a medical mask throughout their shift and only take it off to eat it or drink it. So if you're typing notes, looking over x-rays, the World Health Organization wants you to wear a mask. And a mask should be changed after every patient. Eye protection and or face shields are recommended. So non-medical masks or cloth masks are not considered appropriate for healthcare workers. So obviously, try to space out appointments and keep some distance between the patients in the waiting room. At least 1 meter is what it is saying here. And try not to have more people than necessary when patients are visiting the dentist's office. Sometimes people will bring their spouse or their kids or whoever it may be. If they do require assistance, that would be all right, but try to limit the amount of people in the office. So ventilation is very important, especially when we're talking about aerosols. The World Health Organization is recommending 6 to 12 air exchanges per hour with exhaust fans and or HEPA filters. And patients should be rinsing with 1% hydrogen peroxide or 0.2% iodine for 20 seconds prior to their examination or their procedure. So they do provide some procedure-specific advice. If you're going to clean teeth, use hand instruments, not the ultrasonic. If you are treating a cavity, this one I find pretty interesting. They recommend hand excavation and dressing. And so for those of you that are not familiar, hand excavation would mean taking a little tiny metal spoon and scraping inside of the tooth to pull out as much soft decay as possible, and then putting some temporary filling material in there. Good news is that the World Health Organization does say that anesthetic or the numbing is not an aerosol generating procedure. So whenever it is necessary, they would recommend that. If there is extensive decay, the World Health Organization recommends non-invasive techniques such as silver diamine fluoride or glass ionomer. The little bowl that is sometimes attached to the chair, the spittoon, should be avoided. If aerosol generating procedures are necessary, use high-speed suction and rubber dam with a fit-tested N95 or something that's even better than an N95. So there's some other recommendations: disinfectants to be used, 70% ethyl alcohol, 0.1% bleach for regular surfaces, and then 0.5% bleach if there's a lot of blood or bodily fluids. So stay tuned after this little ad for the American Dental Association's response and my final thoughts. So the ADA responded yesterday, August 12th, in a one-page statement that started by saying that they respectfully yet strongly disagree with the World Health Organization's recommendation to delay routine dental care in certain situations due to COVID. So the president, Dr. Chad Gahani, he stated oral health is integral to overall health. Dentistry is essential care because of its role in evaluating, diagnosing, preventing, or treating oral diseases which can affect systemic health. The American Dental Association in March called for the postponement of all but urgent care. And then in late May, the ADA, with help from the CDC, updated their guidance that in dental offices, they should use the highest level of PPE available: masks, gloves, face shields, rubber dams, high velocity suction, doing a hand scaling instead of that ultrasonic again. And the statement by the ADA concluded with Chad saying, millions of patients have safely visited their dentists in the past few months for the full range of dental services. With appropriate PPE, dental care should continue to be delivered during global pandemics or other disaster situations. So my final thoughts on the World Health Organization's new interim guidance and the ADA's response. So if the spread of COVID is through aerosols that can remain suspended in the air and travel over a distance, be inhaled by someone and cause an infection, I would think that vulnerable populations should avoid going to the dentist for routine dental care. So this interim guidance, the way that it reads, it is trying to aim at both protecting patients, but also, dental staff. It does seem like it's concerned about both the patients and the people that are treating them. And it seems like everyone that is in the building, in the dental office, would be at risk for contracting the virus, whether it be dentists, assistants, hygienists, front desk staff, and or managers, because it's in the air. It's aerosols. Also, you consider not only the patient that's being treated, but also, there's another patient that's next door. And some of these offices, they try to put as many patients, as many chairs as they can in the space that they have. An aerosol generating procedure could lead to, an aerosol or the virus going from one chair to the one next to it, or, depending on how the airflow, how that aerosol is moving in that space, it could, affect whoever's in there. So it might not be a bad idea for everyone inside there to wear a mask. Even patients that are just waiting, maybe they should have a mask on. I was a little bit underwhelmed by the response from the American Dental Association, especially since it took them 9 days to respond. So kind of looking at the two concluding statements from President Chad Gahani. So the first of the two is, millions of patients have safely visited their dentist in the past few months for a full range of procedures. It kind of seems like a faulty generalization. We should really be using the best evidence that we have now to make decisions about what we're going to do now and in the future, not, what has happened in the past. And then, he concludes, with appropriate PPE, dental care should continue to be delivered during global pandemics and other disaster situations. I have no idea why Chad chose to add "and other disaster situations" to that statement. That is definitely a false equivalence. But overall, the situation is fluid. I hope that the World Health Organization does continue monitoring oral health services. Would have been nice to get some interim guidance before August, but I think that the reason this came out now has a lot to do with the understanding of the transmission and the information that came out in July. If you enjoyed this podcast, consider shooting me a message. I'll leave my email in the comments, or if you're watching this on YouTube, put a comment below for an idea for a scientific paper or some information to review. We could do some vaccine research. We could do some hydroxychloroquine if that's your thing. Let me know an idea and we can make an episode out of it.